Hi. Hi. So today we are going to talk about this pancreatic cancer. Sorry, we need to talk about pancreatic cancer and why it's considered one of the deadliest cancer in the world. You understand? Because some persons are going through these issues of cancer and they don't actually know what to do. Firstly, we need to understand the role of pancreas. The pancreas, what it does in our body and why it's considered the deadliest. In fact, if you have pancreatic cancer, you have a low survival rate, you understand, compared to other type of cancer like breast cancer, cervical cancer. The survival rate is very, very slim, and there's a reason for that. Firstly, your pancreas is located deep in your abdomen, just behind your stomach, you understand. So it's not something, if too much should grow in your pancreas, it's not something that you can easily spot. Like now, if I have, God forbid, if I have a tumor on my breast, I can easily touch my breast, right, to know if there's abnormal growth. Hi from India, I can see you, thank you so much, welcome. Now if I have a lumps in my breast, i can I can touch it and check if there's a lump there, right? If I have any kind of growth on my VJ area, I can check if there's anything abnormal. But one thing about pancreatic cancer, because of its location, it is very, very hard to detect early and it doesn't show symptoms. You understand? And one thing about this pancreas, because of its location, tumor can grow. Say you look nice. Ha! Thank you so much with this hair. Thank you. Thank you so much. So, because of its location, the pancreas is very, very hard to detect early. And before you could know that you have this cancer, it has already spread. You understand? I don't understand what you say. But can you hear me clearly? Can you hear me? But you do hear English, right? Thank you so much. So, sorry, my alarm. I normally set alarm around 12. So, now it's 12 o'clock here over in Nigeria. So because of the location of this pancreas, it's very, very hard to detect. Firstly, the pancreas plays two major roles. I'm from Nigeria. Now the pancreas plays two major roles. one one important role the pancreas does is that it produces insulin. The pancreas is the one that releases insulin. The beta cells of the pancreas is responsible for producing insulin. And we all know the function of insulin. You're welcome, you can come. So we all know the function of insulin in our body. Insulin is a hormone that helps to facilitate the uptake of glucose from bloodstream to our cells. So the pancreas is the gland or hormone that's responsible for producing insulin. So one major function of the pancreas is that it controls blood sugar. And the other function of the pancreas is that it helps in digestion. You say, are you married? Well, yes, I'm married. Of course, I'm married. So the second function of the pancreas is that it aids in digestion. Now, for instance, digestion of carbohydrates. Digestion of carbohydrates starts from your mouth when you chew. You understand? Your teeth helps to break complex starch into maltose. Now, your salivary amylase, because we have an enzyme also in your in your mouth that helps to break down carbohydrates. Now, your salivary amylase helps to break down these carbohydrates into smaller pieces, and it travels through your esophagus to your stomach. When food You look such a nice girl anyway. Thank you so much. So when food reaches your stomach, there's no much of the action of the enzyme salivary amylase. The reason why it's like that because your stomach acids stop this enzyme from acting. You understand? The acidity of your stomach, that's your hydrochloric acid, stop this digestion of carbohydrate. There's no much digestion of carbohydrate in your stomach. Now from your stomach, this food is pushed to your small intestine, And the first part of your small intestine is your duodenum. Now, in your small intestine is where more digestion of carbohydrate takes place because your pancreas, yeah, now your pancreas releases an enzyme called your pancreatic amylase. Your pancreatic amylase helps to break down this complex starch into glucose because complex starch cannot be absorbed into your bloodstream. The only thing that can be absorbed into your bloodstream is glucose. You understand? So when it breaks it down to glucose, it gets absorbed from the intestinal wall into your bloodstream. So the function of this pancreas, where can I see can I see your environment? Why will you I'm sitting in a parlor, so I don't know. Okay, let me just swipe a little bit. I don't know if this thing can swipe. Here is my parlor. I can't show you all of them because it will disrupt my view. Oh, let me just show you bits. This is my environment. I can't show you all because I'm talking right now. Okay, want to see? Let me just swap the camera. Let me just stop here for now for those of you that are listening to me. So the function of the pancreas is very, very intense, is that it controls blood sugar, it aids in digestion. So when you have pancreatic cancer, it's very, very, in fact, it's kind of a heartfelt condition. And one thing about pancreatic cancer is that there's no like known screening test that can actually detect this cancer early. You understand? Unlike some type of cancer like breast cancer, mammogram, it can detect it early even without symptoms showing. Like if you can go for breast examination right now, there's a screening test that can test if you have anything like breast cancer. Now if you go for cervical screening like pap smear, there's a screening test that I can actually detect this thing earlier. But when it comes to pancreatic cancer, there's no screening test that can detect this earlier, and that makes it one of the deadliest cancer in the world. And because once it's before it starts, like before symptoms start showing, this cancer might have already spread. You understand? Because I don't know what you wear here. Why do you want to know what I wear? I'm putting on clothes. Isn't that enough? Isn't that enough? My Indian friend, isn't that enough? Okay, I'm putting on a gown. So that is one of the issues why pancreatic cancer is one of the deadliest, because one, it helps to control blood sugar. And if you are diabetic, if you have diabetes, you are at risk of having this pancreatic cancer. You understand? Because diabetes can damage the cells of your pancreas. High blood sugar can damage it. Remember, it's the pancreas that produces insulin. When insulin becomes resistant, your cells in the cells of your body. How is your hair like this? How is my hair like this? I weave it now. This is god braid. You understand? I mean, I don't even like the hair, but I just weave it just to minimize stress for me. It's called braid. If I don't want to weave it, if I don't want to keep it in this form, I can just lose it up and comb it. When I comb it, it will become like afro. It's very, very hard to maintain, and when my hair is in afro state, not actually braided, you understand? Because anytime water touches my hair when it's in afro state, like when I lose it and comb it shrinks. You understand? It shrinks, and it's very hard to comb. So sometimes when I don't want to stress myself, I either braid my hair like this, or maybe I braid it with attachment, like a longer one. So mm, so this is one of the styles. I just feel like braiding it, like I will still lose it, like this. Now I can pour water on my hair. It doesn't, I don't allow it to last for months, for weeks. Thank you so much. Thank you. So I don't allow it to last like this for weeks. I can hardly, high as a week, I just lose it. But I prefer my hair staying in afro state than staying like this. I prefer, because staying in afro state, I look more beautiful with my hair in afro state than weaving it like this. So, but anyway, anything that makes me more comfortable, I just do it. You understand? I'm not a fan of weak. You understand? I don't think I don't think I've ever won anyone. I don't know. But if maybe in the future I might wear, but I'm not a fan of that right now. For now. Mhm. For now. So what is more easy like now, when you break your hair, you can just put on a wig and just go about your daily activity. You understand? So for now, for now, but maybe in the future I can. So I was talking about the pancreas before before you interrupted me. I was talking about the pancreas, why the pancreas is considered as one of the most deadliest cancer in the world. One is because of it can hide. Yes, this cancer can hide, not like other form of cancer that you can easily spot out when you have bump or tumor. Like if I have a God forbid, if there's a bump or in my in a breast, it can easily spot it out, right? If there's any abnormal growth or skin, this thing can easily spot it out. But in pancreatic cancer, this tumor can hide inside because it's located inside your abdomen, just behind your stomach. So this tumor can hide inside for years without you knowing, or for months without you knowing, and it doesn't show symptoms like that. Before symptoms start showing, that means this thing has already spread to your lungs or to other part of your body, to your organs, to your bloodstreams. So that is why it's very very deadly. And one thing again is that there's no screening test that can actually detect this cancer early. So to be honest, I don't understand what you're saying, but you look very good while speaking. Can you hear me? I don't know. Can you hear what I'm saying? Is it that you don't understand English, or you can't hear me properly? Which one is issue? Is it that my intonation? Is it my intonation? Is it how I speak, or you can't hear me clearly? I just want to know. I just want to know. Is it my intonation? Oh, okay, because my English is a bit weak. Okay, that's intonation now. Ah, well, that's how I speak. This is how I speak. This is my. If I use the word, how will I put it? Well, I think I speak fluently. Ah, thank you so much. It's nice to see you. Thank you so much. But can you hear me clearly? If you don't hear me clearly, how come you understand what I'm saying? I think you hear me clearly, but just that maybe you don't get everything I say. Indians has their own form of intonation, the way they speak, like they are this thing. Why us Africa we also have the way we speak. Every continent, every country has their own kind of tongue. You understand? I wish I were married to you. Oh, no, no. That's kind of funny. No, 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 no. I don't. I'm the last. I don't have. I'm the last. But I have either siblings. For female and the last, but I have either sisters. So no, you don't have bad luck. So are you actually from India? Tell me more about your country. Are there blacks in India? Is India like a country that has interracial people, that has different colors, different race? I've not been to India before. So how is India? And what is their official language over there? Is it English, or they have a specific language they speak? The only thing I know about India is India movie, their love movie. You know how all those is it Telemundo? I don't know what they call it. I've forgotten because it has been long since I watched their movie. Growing up, I love Indian movie because they have this their saris. Yeah, you understand. I love their saris. During their wedding, they can. Do you want to come to India? Maybe Sunday. I like to visit the world. I like to visit the world. Yes, I love to come to India. Their saris. One thing I notice about Indian culture is that when they want to get married, that's what I saw in that movie. They can take 1 month to just to get married. Like every day they have to put on different kind of clothes. They have to do this ceremony, do this one. Another day they don't get married once, like one day. Like here in Nigeria, you can bring out 1 day to get married, like our traditional wedding. It's just for 1 day, you understand? Then our white wedding, for those that want to go for white wedding, but it's not compulsory. Because here in Nigeria, our major focus is our traditional wedding. Once your bride price is paid, you are automatically married. What watch do you have on your hand? I don't know. I think it's gold wristwatch or chain wristwatch. So over here in Nigeria, once you are married, they can bring out 1 day and get married. But in Indian culture, they still married, like you can get married for a week, a month. I don't know how it is done. So you can tell me more about India. I love to know. I love to know the saris, the gold. Is the gold not like if they want to get married, they put on several jewelries. It looks so beautiful on them. I really love it. In their saris, particularly that sari, I love it a lot. I love it a lot. So, hi, is India. Thank you so much. You say you sound really nice when you speak. Thank you so much. So, how is India? Do they have blacks in India? I've not been there before. What is Indian like? Do they have different races or just one people, like one race? So, for my audience that are joining my life new, you are welcome. I'm talking about pancreatic cancer and why it's one of the deadliest cancer in the world, and how to spot this cancer early. If you notice abdominal pain, normally notice abdominal pain like back pain and on your pelvic area, please go and check it out. Although this cancer is something that can be surgically removed when caught early, but the issue here about pancreatic cancer is that it's something that you cannot easily um, catch early. Like there's no screening test that can actually figure out this cancer early, unlike breast cancer. Breast cancer, I have a mammogram that can figure this cancer early even without you having any form of symptoms yet. When it comes to cervical cancer, there are screening tests that can detect this early, even without any symptom yet. But when it comes to pancreatic cancer, there's no form of screening test that can detect this thing early. And that is an issue. You understand? Before you start having symptoms already with pancreatic cancer, this cancer might have spread to your lungs, to other part of your body. That is why the survival rate for cervical cancer is very, very slim. Like I mentioned before, cervical cancer, the pancreas, sorry, the pancreas. Sorry, someone is asking a question. Can I come to your place? Sorry, I was talking about the pancreas. Like, okay, can I come to your place? I will be in any danger because I have heard that the environment here is not good and people rob me. Is it true? Can I come to your place? No, there is no place in the world that things don't happen. You understand? There's no place in the world that you not see people that steals. I know that security level in Nigeria is kind of somehow, but there's no place in the world that things things don't happen. bad things don't happen. You understand? But it won't because of that you categorize the whole country or the whole nation that is like that. I might come to India and maybe someone rob me and do something bad. Does not mean that everybody in India are like that. You understand? That is the way it's also here in Nigeria. So that's what I say, stereotype. So it's not really true. You understand? It's not actually true. So there are bad people also, there are good people also. So about pancreatic cancer, I mentioned earlier that for those of you joining my life, the pancreas plays the major two roles in our body. One is it controls blood sugar, the other it helps in digestion. You can come if you want. You can come, it's your flight money. You can just book a flight and come to Nigeria. You're welcome. So the pancreas play a major two role. One is the control of blood sugar, and the second is for digestion. We all know that the pancreas is responsible for producing insulin. The beta cells of the pancreas produces insulin, and insulin is a hormone that helps to control this blood sugar because it facilitates the uptake of glucose from your bloodstream into your cells. Because when you eat and your body has absorb glucose, it rises up. Your sugar level rises up anytime you eat. When digestion occur and your body absorb it, assimilation and the rest, your blood sugar rises up. So the function of the pancreas is to release insulin to regulate it. So certain amounts of glucose or sugar is not supposed to be in your blood. It's supposed to be pushed to your cells because it's your cells that will burn this out. Your muscles, some of them are stored in your muscles and the rest. I don't want to go deep on that. So the pancreas plays two major roles in your body, and one is blood sugar control and the other is for digestion. Now, for instance, digestion of carbohydrates, like I explained earlier, for those of you that are joining my life, when you eat, digestion of carbohydrates start from your mouth. The mouth breaks it down. He said, love at first sight." I think I'm in love with you. Okay, oh, wahala. So when you eat, digestion of carbohydrates start from your mouth. Your mouth start to break it down. I'm a physiologist, a clinical physiologist. So your mouth start to break the carbohydrate down when you chew it. Then in your mouth we have something we call an enzyme called salivary amylase. Your salivary amylase helps to break down this complex starch into smaller starch. So after that, it travels to your esophagus, to your stomach. When this food reaches your stomach, the action of the acid in your stomach stop the action of this salivary amylase. You understand? Because the acidity nature of the stomach does not allow this enzyme to work. So there's not much of digestion of carbohydrate that happens in your stomach because of the acidity of the stomach. So it's more of like movement. So after that, it is the food is passed through and enters your small intestine. Now the first portion or the first part of your intestine is called your duodenum. Your body is bigger than mine. Do you also have six pack? What sort of question is that? Oh God, help me in this life. So when the food reaches your small intestine, your pancreatic amylase releases another your pancreas releases another enzyme called your pancreatic amylase. Your pancreatic amylase is the one that helps to break down this complex starch, this complex carbohydrates into smaller carbohydrate, that's glucose, because the body cannot absorb any form of complex starch. It has to be broken down into glucose for the body to absorb it. So now that glucose is what it's absorbed, because absorption takes place in your small intestine. It's absorbed into your bloodstream. Now when it absorbs into your bloodstream, your sugar level will rise now normally. That is how it's designed to be. Anytime you eat, your sugar level rises up because your body breaks down this carbohydrate to glucose and it's absorbed into your bloodstream. Now, this is where the pancreas come again. You understand? Your pancreas come again by producing insulin, which is the beta cells of your pancreas produces insulin that helps to facilitate the uptake of glucose from your bloodstream into your cells. So insulin works like opening the doors of your of the cells to take in glucose. This is how insulin works actually. So it's like a receptor that opens the door of your cells to allow glucose to enter inside, because it's your cells that will utilize those glucose. You understand? Your muscles, those heat, your sweat is your cells. Energy is your cells. So certain kind of sugar is not supposed to be in your blood. When it's more than that, it can cause harm. That is why people that are diabetic, if you have diabetes, you're at risk of having pancreatic cancer. Because the reason why it's like this is because it gets to a stage where insulin, your cells of your body does not respond to insulin, and this can damage, high level of sugar can damage your pancreas. This is the reason why some person, you see them, they start injecting insulin in their body. The reason why it's like that because their pancreas is no longer working. There's no production of insulin again, so they rely on insulin injection. If you have anybody that suffer from either type 1 diabetes or type 2 diabetes, in type 1 diabetes is that, in type 2 diabetes, it happens when the pancreas, the insulin, like the cells of the body are less sensitive to insulin, while in type 1 diabetes there's no production of insulin. So in type 1 diabetes, it's a kind of a more of autoimmune, you understand? So you see people injecting insulin into their body just to survive. So when you have diabetes, you're at risk of having pancreatic cancer. You look so cute when you smile. Always keep smiling. Thank you. I went to the doctor yesterday and he told me I had a vitamin deficiency. What type of vitamin deficiency is that? What type of vitamin deficiency did the doctor say you had? Let me check up something on my what just doctor will not just say you have a vitamin deficiency without telling you the type of vitamin deficiency you have. Is it vitamin D deficiency? Is it vitamin C deficiency? And which type of vitamin deficiency you have? Did doctor say you have? So as I was saying, vitamin U. Oh God, I've not heard of such kind of vitamin before. Is there anything like vitamin U before? What does vitamin U even mean? What does it mean? So the pancreas, sorry, the pancreas is considered one of the dead pancreatic cancer growth lifestyle within. Hello, Giselle. Thank you so much. How are you doing? Growth lifestyle with Mimi. I'm fine. I'm doing all right. Just came to spend time with my audience, my YouTube audience today. I come live once in a while when I'm chance. Like today, I'm chance. So I said, let me come and spend time with you guys today. So our topic today is about pancreatic cancer. Although I made a video on my channel explaining why pancreatic cancer is considered one of the deadliest cancer in the world. No, and one of the reasons why it's considered one of the deadliest cancer in the world is because of there's no screening test for it at early stage. Yes, pancreatic cancer. Yes, the pancreas plays major two roles in our body. one of the role the pancreas plays for control of blood sugar. Some persons don't know this, but your pancreas is the one responsible for producing that insulin that helps to control that blood sugar. Thank you so much. You say your background is quite good. Thank you so much. Some persons don't know that your pancreas is the one responsible for producing insulin, and insulin is a hormone that helps to control blood sugar by opening the doors of your cells to collect this glucose from your bloodstream. You understand? Someone says she's looking gorgeous with my hair like this. Okay. Oh, someone is flattering me in this life. Oh, I'm so happy. I look like a princess today. Please don't laugh at me. I was not like I almost not come. I was like, let me lose this hair because of the way it looks. Don't mind me. I don't want to come to on my camera because of this hair. I say, God, would I look like this to my audience? Okay. But my audience are complimenting me, say I'm looking nice. Thank you so much. So one of the function of you say Miss Word, Wahala deal. So one of the function of the pancreas is to control blood sugar. Say Miss Word. Maybe I will contest for Miss Word. Hope I win. So one of the function of the pancreas is to control blood sugar. You understand? So and again, it helps for digestion of food. So if the pancreas is actually destroyed, maybe there's cancer of the pancreas, you see that that person will have sudden diabetes, because having sudden diabetes, like you don't have any history of diabetes in your lineage, and suddenly you start experiencing diabetes, can also be a pointer of pancreatic cancer. I'm not saying that everybody that have diabetes has pancreatic cancer. This one asking me, why are you asking me this question? Don't worry, very soon, very soon, very soon. I will have very on it. I'm on it by God's grace. So not everyone that has sudden diabetes have pancreatic cancer, you understand? But when you have sudden diabetes, particularly at adult age, can be a pointer. And one thing about this pancreatic cancer, because of the location of the pancreas is located deep in your abdomen behind your stomach, not like your breast. You can easily access your breast to know if there's a lump or there's an abnormal growth. But what's the early signs? That's what I'm explaining. It doesn't show early signs like other form of cancer. You understand? Before signs or symptoms start showing, this cancer might have spread. So if you start noticing any form of abdominal pain or pelvic pain, can be a pointer. Or if you notice sudden onset of diabetes, like your sugar level starts skyrocketing, can be a pointer of pancreatic cancer. Like I mentioned before, your pancreas, one of its role is to control blood sugar, because your pancreas is the one responsible for producing insulin. The beta cells of your pancreas helps to produce insulin, and insulin is a hormone that controls blood sugar. So when you see a sudden onset of diabetes, particularly at an adult age, can be a pointer that there could be something wrong with your pancreas. You understand? But that doesn't automatically mean that diabetes is, when you have diabetes, you automatically have pancreatic cancer. No, it doesn't always work that way. But these are early signs, these are early symptoms that you should work out for. You say, how old are you? Why do you want to know my age? Okay, you can guess my age. Just guess it. Let me see if you can guess it right. Write it down in the comment section. Let me see. So it's a pointer. And one thing about this pancreatic cancer is very tricky. Like unlike breast cancer, we have a screening test for it, which is mammogram. You can just walk into the hospital and they examine you, even if you don't even have the cancer. You understand? Even if you don't even have symptoms, you say you look like 18 years. I love you. I love you seriously. So for cervical cancer, we have pap smear. You can go for screening even without having any symptoms. But for this pancreatic cancer, There's no early screening test that can actually detect it. You understand? So the tumor also, I am also 21. Oh, that's nice. That's nice. So you can't easily detect it early, just like that. You understand? And it's not like other form of cancer that you can find easily find lumps because of its location in your body, inside your abdomen. You can't easily, just behind your stomach, you can't easily feel any form of lumps or tumor that you can easily touch and feel. You understand? So before symptoms start showing, this cancer might have spread. That is why one of the reasons why pancreatic cancer is considered one of the deadliest, and the survival rate is very, very slim. But one thing about this cancer is that if it is detected early enough, it can actually be surgically removed. Though that tumor, that cancer growth can be surgically removed, but just that is very, very hard to detect early. It's very, very hard to detect early. That is why it's one of the deadliest cancer in the world. If you have any question, you can drop it in the comment section. So that is it for pancreatic cancer. So the pancreas works so many things in our body. One, control of blood sugar, digestion of food. So people that have diabetes, I mentioned this earlier. In fact, there was an interview I was watching online where someone asked a doctor that if maybe you are given a chance to choose between having diabetes or having HIV, which one are you going to choose? Imagine someone asking you between diabetes and HIV, you should choose one. So the doctor was like, if he was given a chance to choose between HIV and diabetes, that he would actually choose HIV. I was surprised. The reason why is I was surprised, we all know how stigmatizing having HIV can be. You understand? It's very, very stigmatizing, particularly for people that don't really understand how this virus works. But HIV actually is not a death sentence because it has treatment. Even there's an injection right now that you can take twice in a year that will help to prevent this virus from spreading or you contacting it. But why would he choose HIV than diabetes, than having diabetes? Now you need to understand that having high blood sugar can damage a lot in your body, can damage your kidneys, can cause damage to the cells of your fetus. You say, how how are your eyes yellow? Okay, this is how my eyes looks. It's not like it's yellow. That has been the color of my eyes from childhood. I was let me not say the nickname they call me when growing up. I don't want to say that here. But this is how my eye looks. Sometimes it will look as if I'm crying, or maybe it's yellow, but it's not yellow. It's just my natural eyes. It's not any health condition, but that's how my eye is. So the doctor, when they asked the doctor should choose between having HIV and having diabetes, I was surprised. This doctor actually choose HIV. I say why comparing how HIV is in our society is very stigmatizing. People stigmatize people that have HIV. Some persons, even till now, that knowledge is free, that you can easily go online and learn things. You know, unlike HIV, you can take medication and get to and be and live a normal life. But when you have diabetes can shut down your kidneys, can damage the cells of your glomeruli, like the filters, the cells that helps to filter things in your kidneys. Having high blood sugar can cause a lot in your body, can cause pancreatic cancer, like the cancer I'm explaining in this video, can damage the cells of your pancreas, can cause pancreatic cancer, can cause so many metabolic issues, can cause heart failure, can cause hypertension. So when the doctor was like, people that don't really understand this thing won't really understand that how deadly having diabetes is. So the doctor was like, if maybe he was given a chance to choose between two illnesses, and diabetes and HIV, that he would choose HIV. Can't I talk for so long? Okay, What do you talk? Why? Why do you talk so much? Doesn't your mouth? Why would my mouth hurt? My mouth is not hurting. My mouth is not hurting. I can't talk for so long. You can't talk for so long. So, I'm live now. So I need to talk and interact with my audience. Not like I talk too much. I don't talk much. Are you still there? Are you still there? Okay, you say that I can't talk for so long. Well, when you have an audience to attend to, maybe you have a live session, you are talking to your audience. I think it's not like talking much because you have to explain to them the reason why you are there. You understand? So it's not like talking much. Say, why do you talk so much? Doesn't your mouth hurt? No, my mouth does not hurt me. In fact, I enjoy it. You understand? I enjoy explaining and imparting knowledge to people. This is what I love doing. This is what I this is what I love doing. Thank you so much. So I was asking you a question about India, but you have not answered me. How is India? Okay, this is a common, common, common 40 Pro. Are you sure you're from India? Because you have not told me anything about your country, honestly. I feel like you're from Nigeria. I don't know, but I'm suspecting. I'm suspecting that you're from Nigeria, but you don't want to tell me the truth. I'm having my suspects that you are from Nigeria, but you don't want to tell me the truth. Because you have not told me anything about India, and I told you that I love India. Like when I see them on movie, like their saree, their wedding, and I'm asking you, why is it that Indians they don't have one wedding? Like I'm from India. I really like you all. You are very nice. Thank you so much. I was telling you that when I watch their movie, they can like their wedding lasts for months or weeks. It's not something they do once in a day. Why is it like that? Can you just give me an explanation? Like, and is it true that in India that the bride will be the one to pay the price of the groom, just like over here, the groom pays the bride price. Understand? Pays the bride price. Why in India? I heard that the reverse is the case. The woman has to pay the price, the bride price of the man. Is it like? Is it true? Is it true? Like in India, the woman is the one that will pay the bride price, the groom price. You're not answering my question. Honestly, you're not. Sorry, but don't know why. Are you not an Indian? Why don't you know your culture? Is it possible that you don't know your culture, how wedding is conducted in your own culture? Is it possible like that? I've not heard of such kind of thing before. Is it possible? Is it possible that you grow up in a country and in an environment and you don't know your culture, how wedding is conducted? Is it possible? You don't understand my English. Which part of my English you don't understand? Is it my intonation, the way I speak, or my tongue? Or is it that the English doesn't sound well? Okay, let me speak loudly so that you understand. Okay, I will speak slowly so that you understand what I'm saying. Like now, in Nigerian culture, I don't know if you can hear me clearly. The the groom is the one that is supposed to pay the bride price. You understand, of the woman he wants to marry. The man is the one that is paying the bride price. But I don't know. But what I've seen in Indian culture is a woman that is paying the bride price of the man. Sorry, the groom price of the man. Is it true? Is it how weddings are conducted over there? I don't know if you hear me. So is it true that in Indian culture the woman is the one that will pay the groom price? I just want you to answer me yes or no. That's all I want. I don't know if you understand me. Since you say you're from India. So in India, is it the woman that will pay the groom price? That's my question. My English is not that hard now. My intonation is not that difficult. It's something that is clear. Although I don't sound like a British because I'm not a British. I'm an African, also a Nigerian. So I will sound my own way. So no, I can't. I can't do that. I can't do that. Let me respond to a message I need to respond. Come on. Please, will you write a question? Will you write your question in the chat? No. So I was talking about pancreatic cancer, why pancreatic cancer is considered one of the deadliest cancer in the world, and the role, the function of the pancreas. So if you have any question, you can drop it in the comments. So two major role of the pancreas. One, control of blood sugar, and the other is for digestion. Because of the location of the pancreas in our body, it's very hard to detect if there's tumor. Unlike other parts of our body, like your breast, you can easily access your breast and touch it and know if there's a lumps or a normal growth in your tumor in your breast. No, I don't. I don't know anything like that. I don't know anything like that. So unlike your breast, you can just easily access it to know if there's any bump or any abnormal growth there. You understand? Your skin, if there's any tumor growing in your part of your body, can easily access it. But your pancreas, because of its location deep in your abdomen behind your stomach, you can't easily access if there's a tumor there. That is why someone might have this cancer and it's there for months, for years. It starts spreading. Before that person is diagnosed, this thing has already spread. Pancreatic cancer, if caught early, can be surgically removed. Like it can remove this tumor, it can be treated. But the reason why it's very hard to beat it, because the survival rate is very slim, is because you can't easily detect it on time. There's no screening test for it. Bye. Thank you. Thank you. Thank you so much. You kept me company today. I appreciate. So there's no screening test for it. You understand? Unlike breast cancer, there's mammogram, cervical cancer, there's pap smear, other form of cancer. There are tests that you can run to assess it early, even without symptoms. Even without symptoms.